President Trump says patients across America deserve access to affordable medication, and today he signed legislation that the White House says will help give patients more information to save on prescription drugs. White House correspondent Mark Irons reports. Good evening, Mark.
Good evening, Lauren. It's one of the rare times in Washington we see legislation pass with wide bipartisan support, and pharmacists believe this law could help patients save money at the drug counter.
The price of prescription drugs, it's way out of whack, it's way too high.
With the president's signature today, drug prices could be cut at the pharmacy thanks to a new law.
The Patient Right to Know Drug Prices Act. And obviously, based on the name, you can tell that this gives people knowledge as to prices at different locations, where to buy the drugs. That will have an immediate impact.
At today's signing, Doug Hoye, the CEO of National Community Pharmacist Association. His group advocates for thousands of pharmacists across the country.
This bill will unshackle pharmacists.
And depending on the medication, Hoye says savings for customers could be enormous. The new law will allow pharmacists to speak freely with patients about lower-cost drug options, removing the so-called gag clause insurance companies could impose.
Well, before there's always the threat of intimidation. A lot of pharmacists would go ahead and talk to patients despite the fear of retaliation from insurance companies that would subtly or not so subtly threaten to kick them out of the network if they told patients too much.
The legislation President Trump signed today passed with sweeping bipartisan support. Only 2 senators voted against it, Republicans Rand Paul of Kentucky and Mike Lee of Utah. A spokesperson for Lee tells News Nightly the senator supports pharmacies being transparent with customers and believes gag clauses should be removed from federal health care plans like Medicare, but he did not support this bill because, quote, Senator Lee does not support federal regulation of what should be state-regulated health insurance plans. Over 40 healthcare-related groups came out in support of the legislation. The National Community of Pharmacists Association says much work still needs to be done to lower drug costs, but this is a good first step. Lauren?
Mark Irons reporting from the White House. Thank you, Mark.